Hello, thank you all for coming. We appreciate your patience in dealing with this as we deal with social distancing and trying to make arrangements for everybody to be here and help get this word out. So we appreciate your help. My name is Chad Bianco. I'm the Sheriff of Riverside County. As you all know, this morning, the Riverside County Sheriff's Department lost Deputy Terrell Young after a battle with COVID-19 virus. Deputy Young began his career on December 8th, 2005, and served Riverside County in assignments at our Larry Smith Correctional Facility, Paris Station, Court Services, and most recently, the Coisburg Detention Center. Deputy Young is survived by his wife and his 4 children. Terrell has been married to his wife Marie for 31 years. He was very involved in all of his children growing up. They were involved with basketball and music and can count on their dad for help. He also got one of his children through med school. He was a fantastic role model for his kids, especially his daughter. He was also very active in his church. He held an MBA in business administration and liked to dabble in the stock market. Employees knew they could count on him for good advice. According to one of his sergeants, Terrell was always on time, very well liked by his peers and supervisors, and always willing to lend a hand. He was compassionate in dealing with both the public and the inmates. He was always smiling. According to many, he was known for his smile, and he will be deeply missed. Because of the questions surrounding this and employees and inmates who have tested positive for this virus, that's the intent of this press conference, is to not only give out information but also answer any questions that you may have. At this time, we have 25 employees who have tested positive for the COVID-19 virus. 22 of them are assigned to the Coisburg Detention Center, 2 are assigned to the Robert Presley Detention Center, and 1 is assigned to Riverside University Hospital. We also have a total of 11 inmates who have tested positive. For the past several months, this is very important for everyone to realize this, for the past several months we have been working very closely with the Director of Corrections Health Services and Administration at RUHS, preparing for this virus to impact our jail system. All inmates have been screened by nursing staff prior to entry, and any found displaying any type of symptoms were quarantined and tested. This quarantine was also implemented for inmates who were already in our custody. Anyone displaying any type of symptoms, any type of cold symptoms, were isolated, quarantined, and tested. During the week of March 16th, Deputy Terrell escorted an inmate to RUHS. The inmate was returned back to his cell that same day. On March 22nd, Deputy Young arrived to his workstation to start his work week. Shortly after his arrival, he fell ill. He determined he had a fever and he went home. The following day, 10 employees, including Deputy Terrell, called in sick with flu-like symptoms. The inmate from the previous week also showed symptoms on that day. We immediately began to quarantine inmates who had been in contact with that inmate and identify employees who had possibly come into contact with either the inmate or any of the sick employees. Numerous employees were sent home to self-quarantine regardless of being symptomatic. Since that time, we have had an additional 38 employees call in sick from the Coisburg Detention Center. It should be noted that after this initial day of employees calling in sick, we emphasize to all employees that no one should or could come to work displaying any type of cold symptoms or if they were feeling ill at all. Like I said, there have been 38 additional employees call in sick from the Coisburg Detention Center. At this time, we have 16 employees waiting on results. 9 of them have returned with negative results, although they do have symptoms, so we're assuming it's a normal flu. We currently have 60 inmates who are in quarantine. Since the beginning of, actually before last week's event, we have had a total of 104 inmates quarantined and tested. 42 of those inmates have tested negative. We are waiting on 51 results, and we have 11 positive tests. It should be noted that on those 11, the 51 pending tests, those are any inmates that display any type of cold symptoms. Doesn't have anything to do with facility. It doesn't have anything to do with contact of other inmates or with staff. It's just any type of symptom. I want to be very clear about the danger and the seriousness of this virus. During the week leading up to Deputy Terrell becoming sick, none of the employees that called in sick that day, including Deputy Terrell, showed any type of symptom. The employees, once they showed a symptom, did not come to work. This virus was spread by employees and inmates that we are guessing, that we are figuring out, that do not show any type of symptom. So it has been very, very difficult to identify infected employees or inmates because we really don't know if they're going to be sick until they come down with a symptom. We have tested all of the inmates in the day room, the pod area that Deputy Terrell worked in that day, and one of the inmates was at. And for the most part, the inmates are coming back negative, but we are still waiting on a lot of test results. At this time, we don't believe, and we are not considering this any type of jail emergency that we are not handling. We believe that we have this contained at the moment. We believe that medical staff is doing a fantastic job of isolating inmates and treating them. All of our inmates that have tested positive or that are sick are being treated by medical staff. And at this time, we have several that have recovered from the virus and others that are still battling the illness. As far as our staff goes, we have implemented procedures at the jail where all of our employees are tested before they come into or they're not tested, they are seen by medical staff before they enter the facility. Anyone showing any type of symptom or displaying a fever is sent home. At this time, no one has been sent home because of that. Employees are calling in sick if they don't feel good, and they're automatically getting tested by the health officials. We are able at this time to accommodate for the loss of staff. We are not in any type of staffing shortage. We have the benefit of the courts being closed because of this virus, and those court employees are supplementing our our jail staff and our patrol staff. At this time, we are not in any type of danger of not having enough employees to man our jails, and it is basically business as usual so far. Obviously, this is an ongoing situation, and we're doing everything we can to contain it. Because of the nature of the virus and employees possibly, or we know they are, spreading this virus without showing symptoms, it obviously is an ongoing, it's an ongoing emergency, if you will, for us. And we are routinely, every day, there are at least a couple of inmates that are calling in sick, and we're waiting on test results for them. I want to impress upon the public, for family members that have inmates in our jails, I can honestly tell you that I don't believe you have anything to worry about for your family members or friends that are in custody. The nursing staff and the medical staff is doing a fantastic job of identifying inmates, quarantining inmates, keeping them separate, and treating them. For employees, the same goes true. We will keep the public updated and advised of any changes that we have in this situation. And at this time, I want to ask the public to avoid the jails, to avoid going to the jails. We are not allowing visitation. We are not allowing outside personnel into our jails unless they work there or they are attorneys that have a legal business of being there. Please stay away from the jails. Please don't congregate around the jails, and do not call the jails for any type of information about inmates or staff. At this time, I'll answer any questions. Yes. For the vast majority of them are deputies. I don't know the breakdown of deputies and correctional deputies. We consider them basically the same. They're just assigned to, everyone is assigned to corrections. I believe that one is an office worker. One of the outside ones is he is assigned to the hospital, to the medical unit at the hospital. It was the week before. He did. That inmate did test positive. I don't know that exact number. Of the inmates that had contact with that inmate is 3. 25 total employees. We have several employees that have been in the hospital or that are currently in the hospital. And we have one employee that is in the hospital. He is in serious condition, that he does not work the jail. He works a patrol station, and it's actually believed, we're not sure if he contracted it at work or on his days off. Yeah, I'm not going to say the total number of employees, but we do have several that are hospitalized. One's in critical condition. They are wearing masks and gloves, and they're being as sanitary as they possibly can, trying to disinfect it, to make sure that they're in a safe environment. Unfortunately, the nature of our business, we can't be completely sure. Unlike the public, if you want to stay away from this virus, stay home. The only way you are not going to get this virus is to stay home. Our employees know that there is a chance that they could get it. We have, because of the staff shortage at the Koisberg facility, we have had to request other employees to go there and work, and it is an overwhelming positive response of employees volunteering to go there to help. So we know that we're putting ourselves in danger, and I guess by the nature of the business, we do it, and we do it willingly. At this time, we don't have any employees in our patrol environment that have tested positive, and all of the inmates or all of the employees that have tested positive, while they are working, have no contact with the public. So I can't speak, it is, and I cannot speak to specifics about individual employees, but I will tell you that we have a variation of employees. We have a gap of early 20s, male and female, to our oldest is 59. The virus is not discriminatory. It doesn't care who you are, and it doesn't care what type of physical condition you're in. We have healthy employees that are getting this virus, and we have some with underlying medical conditions that are contracting the virus. It's unfortunately, it's not going well. The bad part about this, what the public really needs to know is, you can be walking around with it and not know. We have several employees that have tested positive that have zero effects. They have zero symptoms. That shows us that there could be people walking around all over carrying the virus, spreading the virus, and no one knows about it. So the importance of staying away from people, the social distancing part of it, and quite frankly, stay home. The only way you can stop from getting this is to stay home. If you think you're going to beat it, you don't want to be the person in intensive care. He's 54 years old, and I don't want to talk about his family. Not at this time. They have, since he became sick, they have stayed home. I will tell you, they have been sick, but they have quarantined themselves at home, and we're in contact with them. They are fine and recovering. I do, but I won't. I can't talk about that.
Are releasing inmates to try
to. We have, that particular jail has 1,200 inmates. Total jail capacity for our system is 3,700, a little bit more than 3,700. And at this time, there are no plans to pre-release inmates based on what could happen. Should something drastic happen that we have to, then we will address that. But at this time, we're not going to release inmates just because. Unlike most jurisdictions, we don't have the luxury of releasing low-level inmates. There is no such thing as a low-level inmate in our custody. We don't hold them anyway. Countywide. It's about 3,800. We have a little bit more than that. Well, we have, there's a lot of, this is a touchy subject. I mean, we are getting a lot of demands and requests for inmates to be released because they're afraid of them contracting this. If you don't want to catch this virus while you're in custody, don't break the law. That's really all I can tell you. You can't get any more plain than that. Don't break the law, you won't be in jail, and you won't have to worry about it. You can stay home with your family. Statewide, and we are no different than statewide, there does seem to be a decrease in call volume. What that's attributed to, it's really not known. Personally, I would believe that people are home more, and so property crimes are way down, because if you're home, someone's not going to break into your house if they know you're home. Bookings are down, which goes with reported crimes are a little bit down, and also whether, I can't fault deputies and police officers for not voluntarily putting themselves in harm's way. We are doing everything we can to make sure we answer every call for service, and if someone needs to be arrested, they will. But the self-initiated activity is down for law enforcement officers, so that attributes to a little bit of the downturn also. We have an average right now of probably around 50 new books a day, down from around 100.
positive COVID-19
I guess the mystery around this virus is there's no way to say where it went back to, but if we had to guess, being investigators trying to figure out how this happened, we have been going back to months We have done everything we could to try and keep inmates from bringing this into the jail, from employees from bringing this into the jail. So trying to figure out how it happened, we believe we've narrowed it down to that trip to the jail, or to that trip to the hospital. The only reason we are saying that is because of the timing. Why that might not be the case is the gap of time that it's possible, the incubation period for this virus, there's really no telling. It's just impossible to tell. That is really what we practiced on, and separating the inmates has not been a problem for us. The issue for us is we planned on inmates. We didn't plan on staff. So we planned on, we knew we couldn't stop it. We knew employees were going to get it. We knew that it was going to spread. We knew how viral it was, and medical has warned us that how easy it was to contract. We did everything we could to make sure the inmates were quarantined early, kept separate from each other, and we did what we thought we were doing right with employees, but it hit us way too fast. It's not something that we expected. We believe that we have isolated it to that jail and that shift, or maybe even a little bit turning into the other shift. We're on 12-hour shifts, but we also have a lot of people working overtime, which is what we believe has accounted for the positives at other places. For the most part, to be quite honest, a bunch of inmates in a pod in a housing location are relatively safe. If we could keep them all without putting new people in, we could almost guarantee that it's impossible for them to get the virus. The problem is you put a new book, someone gets arrested and booked into jail, and they show no symptoms, and a week later is when they finally show a symptom, but they've been transmitting it all along. So that is the danger of this. It should be an eye-opener for the general public. We are seeing the drastic and the viral aspects of this, and it's not pretty. This is a lot different than any other duty death that we've experienced. And when this normally happens, there is a huge, that we are a very, very tight-knit family. And there is a huge outpouring of support from friends and coworkers and extended family for even for the surviving family. And the unfortunate part of this is all of that it's out the window. I mean, we can't do anything. We can't have contact with the family other than telephone. We can't have contact with each other. We can't have the normal gatherings and support and funerals of one of our employees that dies from an on-duty death. And so this is something that we're all having to learn. And there are a lot of different emotions in the department. There's a lot of uncertainty. There's a lot of anxiety. There's a lot of anger. There's a lot of fear. And combine that with losing one of your friends. And so we have been getting in a very large outpouring of support, social media-wise, telephone calls from the public, and truly we appreciate it. That always helps. He has a wife and kids that are going to need a lot of support and questions that may never be answered. It's a difficult time. So public support is great. quite honestly, if you really want to honor his death, stay home. Stay home, quit going to work, quit going to, I mean, it's hard to say, but this is not going to end unless people quit spreading the virus. And as long as it is being spread, it's not going to end. So if I could appeal to anybody, stay home, quit committing crimes and stay home. Okay, thank you for your time. Thank you for coming out today, and we will keep you advised of additional as it comes available. Thanks.